Now, a fourth and final um, bit of advice for those that are interested in maintaining their hair, their existing hair, or perhaps they've made an investment in a hair restoration procedure and would like to optimize their results. It is very important that you supply these follicles with the appropriate building blocks, the amino acids and the protein substrates, so that you can form keratin and form the correct molecules that will produce good hair mass. One of which that I don't have any scientific data on to share with you, but I do have an amazing amount of anecdotal evidence, meaning I can see in my patient populations that when you introduce biotin in its 5,000 microgram form, which is a very super dose of a water-soluble vitamin. In fact, if you don't take it for a few days, you just sort of urinate it out. It's not something that redistributes in the fat like vitamins A, D, E, and K. Those are the fat-soluble vitamins, and those are vitamins that you have to worry about having hypervitaminosis types of syndromes or toxicities. So biotin is not something that we have to worry really about having toxicities. In fact, it's in that dose that I just mentioned. It's a 5 milligram dose, about a 4-month supply of it from a discount pharmacy may run you about $6. My advice for you is to buy about 3 or 4 of these bottles for $20, and that way you don't run out and then wait 2 or 3 weeks before you get it again, and then there's sort of a compliance issue that confounds how well you're responding to this. Now, what I can tell you is that if you're taking biotin and you begin to take this biotin and you are sort of taking it for a couple of weeks, you will definitely notice that when you're normally clipping your fingernails perhaps every 5 or 6 days, you'll be doing it every 2 or 3. When you notice that you got a haircut every 4 weeks or perhaps 5 weeks if you've been particularly busy, you will see that you'll notice that you need them almost every 2 to 3 weeks. Now, what it does not prove to you is that you will take an existing hair follicle that is miniaturized and have it wake up. Okay? It's not going to regrow hair where you're not growing hair. However, it does a couple of things in the pre-transplant phase of my practice. First of all, it allows for the recovery phase, and it allows for healing and cellular turnover to occur at a much more rapid rate. And so when we're taking hair follicles in the back of the head in the donor area, each individual hair follicle that comes out is also healing at a much faster rate, and the adjacent hair follicles that we don't take out are growing hair faster, and so it helps to cover that donor area within a matter of a couple days, sometimes even less than a week, and you can't tell anything behind you. The second thing that I'm seeing with the introduction over this last couple of years with biotin into the practice is that the phase of resting after you put in the hair follicle, after you transplant it, typically a large percentage of those, 80 or 85%, may go into a resting phase, a phase that we call telogen. And during that phase, the follicles will rest for 90 to 120 days before waking up. What I'm seeing when I'm pre-treating patients with biotin, even as little as 2 or 3 weeks beforehand, I like to do it for a month, but even with a little bit less, I'm seeing that those patients are waking up faster. Those hair follicles are gaining a momentum and starting to grow, and you're starting to see them come up faster. Now, there's no quantifiable way that I know of currently that I can prove that this happens at a faster rate. It's just something I'm seeing in my patients as I've introduced that modality into the patients. And that's it.